Let's get started with Nancy from Little Rock. And Nancy writes, I'm 59 and my husband is 62. We've done pretty well so far, and I'd like to retire early at 63, but I won't qualify for Medicare until I'm 65. What health coverage options should I look at to bridge that 2-year gap? Nancy, thanks for the question. So the first question that comes to mind when you tell us about your ages of you and your husband, is your spouse retiring with you? Because that's a big one there, and I'm going to assume that maybe he is, because one option for you if he wasn't is to stay on potentially his health care plan through his job if he has one, but maybe he doesn't have one. It would probably be the most cost-effective way in most cases to look towards his health care coverage. But Teresa, when you think about only having a 2-year gap, the next thing that comes to mind for me is taking a look if she has a COBRA plan option through work, which most employers do offer.
Yes, the benefit of that is that you get to keep the coverage you've had up to this point, so there's familiarity there while you're bridging the gap to your Medicare options. The kind of downfall to it is that it's going to be more expensive. COBRA coverage is usually not cost effective. So it's really important to look at your income. Maybe it's subsidized somehow if you use one of the marketplace options instead. Look at your expenses and see if you can afford it. If you've been on some sort of care plan through your physician, though, where having the same coverage is really critical, that COBRA option overall may still be the best option for you.
Yeah, we don't know much about Nancy's health situation. So if she does have something that she needs coverage for, you really have to check out what plan you're moving toward, whether it's your husband's plan at work or obviously COBRA is the best option because you'll get the same plan. But the cost effectiveness, as Teresa mentioned, is a little bit more difficult because in essence, basically when you're getting health insurance through your employer, they're paying half of it, you're paying half of it. And when you go into or you're terminated or you retire, however you leave that job, you're taking on the full cost of that health care premium. So it could be potentially twice as much to carry, but typically the law will let you do that for 18 months. So when it is only 2 years, if you can deal with that cost, you're almost getting yourself to Medicare just by checking out that option.
I do think if you are looking at using the marketplace, let's say the COBRA is not realistic and you are going to be using the marketplace, something to understand about that is that coverage is not just comprehensive typically like your employer plan would have been. I know when I was shopping for that during a period of time when I was needing to use the marketplace before I worked here, I found that things like maternity care were not standard. You had to pay extra for those. So obviously you're probably past the point of that, but there are other things like your typical drug, prescriptions and things like that. You want to make sure you understand what the plan will cover, what the expenses out of pocket will be, because there might be more variance than you're used to looking for.
Yeah, and do you have an HSA, Nancy? That's one thing you didn't tell us in your question, a health savings account. That is a great option to start beefing up. Now, obviously, you're telling us in your question that you're 62 already and want to retire at 63, so you're not going to really be able to add to that right now or start one and get really anywhere with it in 12 months if you retire. But for everybody else listening, if a health savings account is an option, certainly an option is to take advantage of that because you can get money into it. And if you don't intend to use it in the near term, you should be investing it for growth so that you can have more in retirement. You know, healthcare costs is one of the largest costs you're going to have, one of the biggest expenses you're going to have in retirement. A Fidelity study fairly recently estimated that a 65-year-old couple will need $300,000 to spend out of pocket, and that's after Medicare age, right? Yeah, that's after you reach Medicare. So those are things that are still going to be on you to pay for. So having a plan for that and having funds for that is certainly very important. The health savings account is a great way to build some tax-free income for healthcare expenses.
And I do want to clarify, there are different health savings account types out there. The health savings account that you're talking about is the one that is portable with you. There are these accounts called flexible spending accounts that employers offer. We have that here. That is a use it or lose it every single year plan. So I do want to clarify, if you have an FSA, it won't serve the same purpose as what Scott was talking about a moment ago.
Yeah, to be eligible for the HSA, you have to have a high deductible health insurance plan, and then it has to be offered. And once it is, you can put, I believe, is it $7,000 for family or $3,500 for individual,
That
something
sounds
around
right,
that as
something
far
around
as
that.
the
It
annual.
changes so often that I don't memorize those usually.
It is hard to keep up with. But a little bit of money can get in there, and then you can grow it for later use. You can also use it during your pre-retirement years too. But it goes in, it's actually double tax free because you can make a pre-tax contribution and then withdraw it tax-free if it is for a qualified health expense, and that list can be found online, or you can talk to an advisor to find out that list of what is covered in tax-free withdrawals. So certainly having more funds to pay for out-of-pocket health care cost would potentially save you on premiums, because you could maybe get a plan that has a higher deductible and a smaller premium because you have the money to be able to handle those out-of-pocket expenses. And the other thing too is I would say, don't get laser focused on just bridging the gap to Medicare. I think a lot of people, Teresa, feel like Medicare is the finish line. If I can just get, because honestly, the most popular age to retire in the United States is age 65. Why is that? Because I've made it to Medicare age. It has nothing to do with really anything else except I'm now on government assisted health care. But Medicare A is not going to cover much. And when I say A, I'm saying
Part A.
Yeah, Part A is not going to cover, it's going to cover hospital care, and that's just about it. That's free. Your Part B premium will cost starts at $185 a month per person, and if your income's higher, it could be more. That's going to cover more things, but you have to really educate yourself or get some help on looking through all of the Medigap policies, Part D, the prescription drug plan, and all of that type of thing.
And I encourage getting coaching on that. That's not necessarily something that I can do, but I encourage all of my clients to get coaching, and not just once, but every single year in retirement, because those drug plans especially, they change over time. So what may have been a great product for you last year, next year may not be a great product. So it's important to collaborate with your pharmacist and a good coach to help you each year pick the plan that's right for you.
All right, so before we move on, one thing that she said there that really stuck out to me too is she said, we've done pretty well so far. That's a little vague for me, Nancy. I'm going to be honest. What does that mean to you? You've done pretty well so far. What does your retirement income look like? Have you built a retirement income plan to know what you're going to receive monthly when you incorporate all sources of income, like Social Security? Is there a pension? How much have you saved in your employer plans and other investments? And what is that going to mean to you in a monthly income stream? Done well on savings is a feeling. It's not a fact, right? And how does that translate into income? And I think the piece here, that the reason I bring that up mainly is everybody needs a retirement income plan, but Teresa, incorporating healthcare costs into that, because maybe their basic lifestyle that they want in retirement is going to be more than covered by the assets they have. They can start to really do some things for healthcare then.
Yes, I've joked before that some people want to go to Paris, Arkansas. Some people want to go to Paris, France. Those are two very different retirements, and your asset level for each of those is different. So it is really important to get some empirical data about where you stand before you pull that trigger. And the sooner you do that, the better, because if you need to make some adjustments, you've got the time to do it. But if you wait until you're retired, then it's just a matter of, well, we'll do what we can with what you've got. But I would love to get with you sooner so we can help you get a plan that works great for you, including the healthcare need.
The importance of not making a decision in a vacuum about anything when it comes to retirement and financial independence. Healthcare cannot be a standalone choice. It needs to be incorporated into a holistic retirement plan unique to you.